I have gone through the previous year questions for let's say the last 5 years, and in last 5 years, if we analyze the number of questions that have been asked in the INI-CET from anatomy, it stands to 126, and this is the number of questions that have been asked in both May as well as November exam, right? So out of, let's say, 2000 questions over last 10 exams in 5 years, this is the number of questions in anatomy that have come, right? So each exam you can expect anywhere between a minimum of 6 to a maximum of 12 to 14 questions from anatomy. And surprisingly, most of the questions from anatomy will be the topic from the neuroanatomy or nervous system. So nervous system is like one of the favorite topic for all the paper setters, all the examiners, let it be your university exam or entrance exam. So first, what we'll do is, in neuroanatomy, we'll try to understand what exactly are the topics from which the questions have been very frequently asked, right? So first, let's try to list the topics and see the topics from neuroanatomy, and then we will also go through some of the topics that have been very frequently asked from, let's say, embryology, then from gross anatomy, from different regions, head and neck, abdomen, lower limb, etc. Right? Now, what are the topics that are very frequently asked from neuroanatomy? And the most commonly asked topic from neuroanatomy has been the topic of cranial nerves. Now, when we talk about cranial nerves, this could be a simple classification of cranial nerves. Then, how exactly these cranial nerves enter or exit the skull through various foramina. Then, it could be on the functional components related to each of the cranial nerve. Then, the nuclei that are associated with these cranial nerves, the functions of these cranial nerves. Right? And the cranial nerve anatomy will also be very essential if you are trying to do the clinical examination of CNS, especially the examination of the cranial nerves part, right? So cranial nerves are one of the most essential and important topic in anatomy that you must be thorough, right? So one is cranial nerves. Apart from this, there are a lot of questions that have been asked on functional areas of the brain. The different functional areas of the brain, what are the clinical syndromes that result because of the lesions of these functional areas? The second commonly asked topic. And the third topic is the fornix, right? What are the type of association fiber or white matter present in the brain? Surprisingly, every year or every alternate exam, you will have one question on the anatomy of the fornix. Then we also have a lot of questions coming from the anatomy of limbic system, the components of limbic system, the functions of limbic system, then the neurotransmitters involved, the connections of the limbic system, and also the disorders associated with it, right? Then the thalamus. I'm sorry, I had not shared the iPad. So the thalamus, right? Now, thalamus, limbic system, these are some of the topics that are very frequently asked in your entrance exam. Then the coronal section of brain, right? So coronal section of the brain, identification of different structures in the coronal section of brain. And then this is the list of topics that are very frequently asked in your neuroanatomy, right? Now, apart from these topics that are asked in neuroanatomy, some of the other topics that are very frequently asked include the topics from embryology. And in embryology, one of the commonly asked topic is the topic of pharyngeal arches. I'm really sorry. I think the iPad screen is visible now. Yeah, thank you. So one important topic in embryology is the pharyngeal arches. Let it be pharyngeal arches, pharyngeal pouch, pharyngeal cleft. What are the derivatives? Let it be in terms of cartilages, let it be in terms of muscles, then arteries. All these questions are very frequently asked. So pharyngeal arches is one topic in embryology that you must never skip. And when you come to general embryology, you get a lot of questions from the topic of primitive streak or notochord or embryonic folds. So these are from your general embryology, right? Especially the development that occurs during the first 3 weeks after gametogenesis and oogenesis, the cleavage division, right? Starting from cleavage division, if you want to focus on one important topic in general embryology, then these are the ones. Apart from this, also you should be thorough with the derivatives of the germ layers, ectoderm, endoderm and mesoderm. Then if you come to systemic embryology, you get a lot of questions from development of the CVS, and this is directly correlated with the congenital heart diseases that you study in pediatrics. So you get a lot of integrated questions from the topic of development of CVS. Apart from this, you also get a lot of questions from development of urogenital system, the derivatives of mesonephric duct or paramesonephric duct in urinary system, especially the development of the urinary bladder and development of the kidney. Then in the other part of systemic embryology, you will get a lot of questions on the development of GIT, right? So these are some of the commonly asked topics from embryology, right? Now, apart from neuroanatomy and embryology, if we come to gross anatomy, of course, you get plenty of questions from neuro and embryology. These are the two topics that most of the time as an undergraduate, the students will not focus clearly, right? So these are topics which carry less weightage in university exams. So most of us tend to skip this. But for our university exam, these are the topics that carry good marks. So these are the topics that you must be thorough with, right? Then from gross anatomy. Now, again, the weightage for gross anatomy increases with the topic of head and neck, right? You get comparatively more number of questions from the head and neck, and these are usually centered around these subtopics. Every year, you can see a question on pterion, right? It's almost there in every exam, right? So this is one topic that you must thoroughly study, pterion, right? Then the foramina of the skull, right? Of course, foramina of the skull, we will try to cover up today when we discuss about the cranial nerves, how they enter or exit the skull, right? Then thyroid gland. Now, we have not seen questions from thyroid gland from past couple of exams. So this is one topic that you may want to be prepared thoroughly for this year exam, right? You can get a lot of questions on thyroid, especially its relations, the relations of the lobes of the thyroid. Apart from that, you may expect questions on the blood supply, especially the arterial supply. Okay, so this is one topic that you may want to look out for your INI-CET May 2024. Then you get a lot of questions on parotid, the muscles of mastication, the infratemporal fossa where you have the mandibular nerve, the branches of the mandibular nerve, chorda tympani or the otic ganglion. These are very frequently asked. Mandibular nerve, as I mentioned. Then one more very important topic is blood vessels of the head and neck, right? In blood vessels of the head and neck, the branches of the subclavian vessels, the subclavian artery, branches of the external carotid artery and internal carotid artery, their level of termination. These are the topics that you may want to study thoroughly, right? Then you can expect a lot of questions from the topic of tongue, including its nerve supply and development. Okay. Then you can get a lot of questions from the topic of larynx and pharynx, especially the cartilages of the larynx, the muscles and ligaments of the larynx, its nerve supply. And in pharynx, it's mostly the relations or the structures related to the nasopharynx, their nerve supply and the constrictors. So these are some of the topics from which you get a lot of questions in head and neck region. Okay. Apart from this, if you come to abdomen and pelvis, one hot topic in the anatomy of abdomen and pelvis is the inguinal canal. Again, directly related to general surgery, where you get a lot of questions on the inguinal hernia, right? So inguinal hernia, the different boundaries of inguinal hernia, including the inlet and the outlet, the walls, the different defense mechanisms, then the contents, all these are very frequently asked. Okay. Then in GI organs, you get a lot of questions on the relations of the duodenum. Okay. Relations of the 4 parts of the duodenum. Then you get a lot of questions on the relations of the stomach, especially its posterior relation. You get a lot of questions on its vascularity and lymphatic drainage, right? Then you get a lot of questions on relations of the kidney. especially the anterior and posterior relations. Posterior relations, we know it's almost the same except for one difference on the left side. Then you get questions on urinary bladder and urethra. Again, urethra is one topic that we usually do not study thoroughly, right? So this is one topic that you may want to study thoroughly for your entrance exam, the urethra. Then pelvic diaphragm, okay? Every year you get one question from this topic, okay? Pelvic diaphragm. The anatomy of pelvic diaphragm again is directly related with the uterine prolapse or the prolapse of genital organs, okay? So this is one topic that you may want to study thoroughly, right? Now, apart from this, the supports of the uterus, as I just mentioned. Supports of the uterus, including pelvic diaphragm, are very important for your entrance exam, fine? And they are clinically correlated with the questions from your OBG. Then in the thorax, the anatomy of the heart, the anatomy of the exterior of the heart, interior of the heart, and its arterial supply, especially arterial supply. They will give you a particular artery and they will ask you occlusion of this artery will cause the infarction of which of the following area. So area of distribution of coronary arteries is very important for your exam. Apart from this, we have seen a lot of questions on the anatomy of the lung, right? Especially the relations of its mediastinal surface, the arrangement of structures in the hilum. Apart from this, we have also seen questions on histology of the lung and especially how to identify different parts of the respiratory tract, right? Different parts of respiratory tract when you take a histological section of the lung. For example, how do you identify a bronchus, a bronchiole, all these questions, okay? Then the structures in the posterior mediastinum, the azygous venous system and the thoracic duct. Okay, so these are the questions from the thorax. And in upper limb or lower limb, you must thoroughly learn about the joints. In the joints, focus mainly on what type of joints they are and know the names of the ligaments and attachment of the most important ligament of that joint. But if you are studying joint, one thing that you must never skip is what are the movements occurring at that particular joint and what are the muscles that bring about movement at these joints, okay? Now, this is what is very frequently asked. For example, what muscle brings about abduction of the shoulder, right? What muscle brings about extension of the hip? So, for each joint in the limb, you must thoroughly know what type of joint it is and what movements occur at these joints along with the muscles. Then, apart from this, in the upper limb, you get a lot of questions on the nerves of the upper limb, right? For example, median nerve, ulnar nerve or radial nerve as a whole, right? It's not like you study the median nerve in the axilla or the arm. You should know the comprehensive course, branches and area of distribution along with clinical anatomy of each of these nerves of the upper limb, lower limb, right? And the clinical correlation with orthopedics comes very handy here, right? When you know the anatomy of nerves of the limbs. Then one more favorite topic of examiners, especially in case of upper limb, is the intrinsic muscles of the hand. Let it be thenar muscles, hypothenar muscles or the interossei or your lumbricals, okay? The nerve supply of these muscles especially is favorite. Nowadays, they don't ask the nerve supply of first lumbrical or second lumbrical, what is the nerve supplying it. Instead, they will give you a cadaveric image where you will be asked to identify the action of a pointed muscle or the identification of nerve supply of a pointed muscle. Now, you don't have to worry about these questions, okay? Whenever you see image-based questions that are related to anatomy, simply think that these are extensions of the spotter exam that you have already given in your first year. Okay, so the questions are not direct. Instead, they will slightly twist the question and ask. Fine. So all you need to do is keep your cool, identify the structure and mark the correct answer. Okay. Especially in lower limb, we have seen a lot of questions being asked on the anatomy of gluteal muscles, okay? The gluteus maximus, gluteus medius and gluteus minimus. So these muscles, their innervation and action. Even in innervation, if you go through the previous year question, you can find a lot of questions on the superior gluteal nerve. the muscle supplied by superior gluteal nerve. What happens when the muscle supplied by it get paralyzed? What is the anatomical basis of Trendelenburg test? Which muscles are injured? If Trendelenburg is positive on one side, which side nerve or which sided muscle are paralyzed? These are the questions that often appear in your exam, every alternate exam. So gluteal muscles and the gluteal nerves are one important topic from lower limb that you must never skip. And if you're talking about the lower limb, you must learn about the veins of the lower limb. Right? Again, directly related to your general surgery, where you will study a lot about the varicose veins, anatomical basis for varicose veins, the organization of the lower limb veins as superficial veins, deep veins, or perforators. Okay. Now, this is regarding the commonly asked subtopics from different parts of anatomy. Let it be neuroanatomy, embryology, or gross anatomy. But if you're preparing for your entrance exam, I would suggest you please start with your neuro topics. Become thorough with the neuro topics which are like very frequently asked, and then you can shift to embryology, and then you can do the other topics from head and neck, abdomen, pelvis, thorax, and limbs. Right? This is the order that you can follow when you prepare for your exam, right? So this is regarding not a comprehensive list, but this is a list of topics that you must never skip if you're preparing for an entrance exam. Fine. With this, what we will do is we will directly go to one of the commonly asked subtopic in your entrance exam, and possibly one of the most important topic, and seems little bit complex, and most of the students try to mug it up. Okay. Now there is no point in mugging up some of the concepts that are related to your central nervous system, as we will learn in this session. Okay. So what we'll do is we will discuss about the cranial nerves, and in cranial nerves we will try to focus our discussion on the cranial nerve nuclei and their functional components. Again, one of the very frequently repeated question, let it be an image-based question or case-based question. So as and when we come across each subtopic in cranial nerves, we will talk about what MCQs have been asked and how to approach these MCQs. So we will begin with the actual topic for today's discussion, that is the topic of cranial nerves. Right? Now, before we get started with the anatomy of cranial nerves, what exactly do you mean by cranial nerves? Fine. If we just go back to the anatomy of the nervous system, we know that the human nervous system can be broadly divided anatomically, right? So the nervous system can be anatomically divided into what? It can be divided into central nervous system and peripheral nervous system. Right? The central nervous system includes brain, it includes spinal cord, it includes the optic nerve, and it includes the retina. So these are the components of central nervous system. Similarly, when we talk about peripheral nervous system, we have the peripheral nerves, right? We have the peripheral nerves, then we have the ganglia, and then we also include your autonomic nervous system as part of the peripheral nervous system. And when we talk about peripheral nerves can be cranial nerves or spinal nerves. Now, what exactly are cranial nerves? Remember, cranial nerves are those which are attached to brain. Let it be the forebrain or the midbrain or the hindbrain, fine, or the brainstem. If a nerve is attached to the brain, it is called as a cranial nerve, right? Now, cranial nerves are arranged as 12 pairs. Yes, Deep Nayan is absolutely correct. Cranial nerve refers to set of 12 paired nerves, right? But how exactly we do define it? So these are the nerves attached to brain. Okay, so these are the nerves attached to brain. The nerves, if they are attached to spinal cord, so you call them as what? Spinal nerves. And how many spinal nerves do we have? What is the number of spinal nerves do we have? We have 12 pairs of cranial nerves, that is rightly said. Can someone tell me how many pairs of spinal nerves do we have? Deepnayan, would you like to try? How many spinal nerves do we have? Remember, we have about 31 pairs of spinal nerves. Right? Now, this is just to get introduced to what exactly are cranial nerves. Most of the time, we end up saying there are 12 pairs of cranial nerves which begin with olfactory nerve and end with hypoglossal nerve. But what exactly are they? Remember, cranial nerves are the nerves that are attached to brain. Right? When we talk about spinal nerves, there are 31 pairs of spinal nerves, and these 31 pairs are arranged as 8 pairs in the cervical region. Absolutely. Dr. Vinay, Dr. Meenakshi, Ravinder, Adnan, we have 31 pairs of spinal nerves, and these 31 pairs are organized as, yes, Deepnayan, there are 31 pairs. So we have about 8 cervical spinal nerves, then we have 12 thoracic spinal nerves, then we have 5 lumbar, 5 sacral, and 1 coccygeal spinal nerve. So this is regarding the number of spinal nerves that we have. Fine. Now, since you said we have 12 pairs of cranial nerves. Okay. Now this is an interesting question, or this is a viva question of some of the examiners. Do we have a 13th pair of cranial nerve? So can somebody tell me, is there a 13th pair of cranial nerve? If there is a 13th pair, or it is also called as the 0th pair of cranial nerve. Have you heard of this? And if you have heard, which nerve is exactly called as the 13th pair or the 0th pair? Now, this is an interesting fact related to the cranial nerves. Remember, the 13th pair of cranial nerve is described by some authors as to be the nervi terminalis, which is associated with your olfactory system. Okay. Now, remember, there is no well-defined 13th cranial nerve, but some authors refer this to as the 13th pair of cranial nerve. Fine. So, this is regarding the 13th pair of the cranial nerve that I was talking about. So, this is regarding the cranial nerves, right? Now, what we'll do is, we'll try to learn some of the facts that are related to cranial nerves and how exactly these cranial nerves are numbered, where exactly they are attached. Okay. So can you tell me, how do we number the cranial nerves? We all know that there are 12 pairs of cranial nerves, right? Can you tell me how exactly do we number these? As we have named the olfactory nerve as the first cranial nerve. We have named the hypoglossal nerve as the last cranial nerve, right? How exactly do we number this? Anyone? Would you like to try? How exactly do we number cranial nerves as 1 to 12? Anyone who wants to try, like, how exactly these are numbered? Yeah, Aniket says these are numbered from anterior to posterior. Very good, Aniket. These cranial nerves are numbered from anterior to posterior based on their attachment. So in order to understand this, we must know where exactly the cranial nerves are attached to. Okay. Cranial nerves, remember, are attached to the inferior surface of the brain. Okay. So they are attached to the inferior surface of brain, and based on their attachment from anterior to posterior, right? Based on their attachment from anterior to posterior, these are numbered as cranial nerve 1 to cranial nerve 12. For example, olfactory nerve is attached to the inferior surface of the forebrain, and behind that we have the optic nerve, and behind we have rest of the 10 cranial nerves. Okay, so well said, Aniket. You're absolutely correct. Cranial nerves are numbered starting from anterior to posterior. Done. Now, the first two cranial nerves. Now, what are the first two cranial nerves that we are talking about? Let it be olfactory nerve or the optic nerve. Remember, both these nerves are attached to the forebrain. Okay? We know that the human brain has three parts, right? We have the forebrain, then we have the midbrain, and then we have the hindbrain. The forebrain includes two important structures, right? What are they? One is the telencephalon, which is represented by the cerebral hemispheres. Whereas the diencephalon part, as we know, is represented by the thalamus and the structure surrounding it. The thalamus, epithalamus, subthalamus, metathalamus, all these come under diencephalon. Okay. So olfactory nerve and optic nerve are attached to the forebrain. Done. Now what about cranial nerves 3 to 12? Remember, cranial nerves 3 to 12 are attached to brainstem. Now, what exactly do you mean by brainstem? Which parts of the brain are together called as brainstem? Can you tell me what is the meaning of the brainstem? What parts does it include? I'll wait for your answer. Like, what are the parts of the brainstem? Because this is very important to understand, so that we understand the attachment of the cranial nerves, the exact site of cranial nerves, and we also understand the position of the cranial nerve nuclei, right? So what exactly do you mean by brainstem? What are the three parts that actually constitute your brainstem? Starting from cranial to caudal region. Very good. Thiru says midbrain, pons and medulla. Well said, Thiru, right? So we have what? We have the midbrain, then we have what? Pons, and then we have the medulla oblongata, right? Yes, Ravinder. Hariharan. Yeah. So all of you are correct. So midbrain, medulla and pons put together is what we call as the brainstem. And remember, this is different from the term that we use as hindbrain. And hindbrain includes what? Pons, cerebellum, right? And it includes the medulla oblongata. Yes, Prashant, Mahima, correct, right? So this is regarding the difference. Now, why we are discussing this? Oculomotor nerve to hypoglossal nerve, these are exclusively attached to brainstem. And remember, when we talk about cranial nerve nuclei, or when we talk about the functional components associated with the cranial nerves, these are related only to 3rd to 12th cranial nerve that are attached to brainstem. Okay, so cranial nerve nuclei and their functional components are exclusively present in brainstem. Now, when we talk about midbrain, remember the 3rd and the 4th cranial nerves are related here. That is oculomotor nerve and trochlear nerve, right? Then what about pons? The only nerve that is attached to pons is your trigeminal nerve or the 5th cranial nerve. In between the pons and medulla, we have a junction called as pontomedullary junction, and pontomedullary junction gives attachment to your abducens nerve, facial nerve, and your vestibulocochlear nerve. Right? So these are the nerves that are attached to pontomedullary junction. We will identify this. The medulla oblongata, whereas, will give attachment to the 9th, 10th, 11th and 12th cranial nerves. Right? So these are the attachment sites of attachment of cranial nerves. Of course, we will learn little bit in detail about the attachment of the exact site of attachment of these nerves, right? At this point of time, if you have any doubts, you can just put it in the chat box. I'll try to clarify it before I proceed to the next slide. Any doubts you have with whatever we have discussed till now? Done, right? So what we'll do is we'll move on to the classification of cranial nerves. Fine. The simplest way of classifying cranial nerves is you classify them into sensory, motor or mixed cranial nerves. Fine. Now, what we'll do is, before we do this classification, let's try to list down all the 12 cranial nerves that we have, starting with the first one. So the first cranial nerve we have is olfactory, right? So we have the olfactory nerve. The second one is the optic nerve. The third one is oculomotor, right? And the fourth one we have is the trochlear. The fifth one we have is trigeminal. And the sixth we have is abducens. Right? So these are the first six. Then the seventh cranial nerve we have is facial. Then eighth we have is the vestibulocochlear. Right? Then ninth, glossopharyngeal. Then we have the 10th cranial nerve, which is vagus. Then we have the 11th, which is the accessory nerve. And we know that the accessory nerve has two parts, right? One is the spinal part and the other one is the cranial part. And the last of the cranial nerves we have is hypoglossal nerve. So how do we actually remember which of these nerve is actually from the sensory nerves, or which of these are motor, or which of these is mixed, right? We will come to it. I think DSMET says, please explain facial colliculus. We'll come to that. And Deep 9 says, I write all the cranial nerves from 1st to 12th. Okay. Now, this is regarding the 12 cranial nerves, right? Now, how exactly do we classify them as sensory or motor? Remember, we have a simple mnemonic for this. So, the mnemonic goes like this. Okay. So it says, some say marry money, right? Some say marry money, but my big brother says big brains matters most. Okay. Now, this is the mnemonic that we often use to learn the type of cranial nerves that we are talking about. Okay. Some say marry money, but my brother says big brains matter most. Remember, S here stands for sensory, right? S here stands for sensory, M for motor, and B for both or mixed. Right? For example, let's talk about the olfactory nerve. Right? Now we know that the function of olfactory nerve is sensory. Right? It carries the sensation of smell. So that is purely sensory. And some of the authors also say that there is nothing called as pure sensory, pure motor, or these components always have some mixed component always. But for the sake of convenience, we classify the cranial nerves as sensory, motor, or mixed, or predominantly sensor, predominantly motor, or mixed cranial nerves. So olfactory nerve is sensory. Optic nerve concerned with the vision is predominantly sensory. So instead of using the term purely sensory, you can use predominantly sensory. The oculomotor nerve, which supplies the extraocular muscles, majority of the extraocular muscles, is predominantly motor. Okay? So this is predominantly motor, oculomotor nerve. Then we have the trochlear nerve, right? Trochlear nerve supplies only one muscle, right? Which is that the superior oblique, one of the extraocular muscle. So this is also a purely motor nerve. Then we have the trigeminal nerve, and trigeminal nerve, remember, is an example for mixed cranial nerve. And mixed cranial nerves are little bit complex because they have both sensory component as well as motor component. Right? So what about the abducens nerve? Remember, abducens nerve again is purely motor. And remember, abducens nerve also supplies only one muscle, that is the lateral rectus. Done? Right. Then the facial nerve again is an example for a mixed cranial nerve, meaning it has both sensory component as well as motor component. Right? Then the vestibulocochlear nerve is concerned with the hearing and equilibrium. So it is predominantly sensory. Then we have the glossopharyngeal nerve, which is mixed again. It has both sensory component and motor component. Right? Then the vagus nerve. Even this has both components, sensory and motor. Whereas the last of the two nerves, that is axillary nerve and the hypoglossal nerve, are predominantly motor cranial nerves. Right? So this is how we can actually remember the types of cranial nerves. Now, why is this important? Sometimes in your exam, they will ask you to identify what are the functional components present in each of these cranial nerves. In order to identify the functional components, the first thing you must always know is what type of nerve it is. For example, if the nerve is purely sensory, you can always rule out all the efferent components. If a nerve is predominantly motor, you can always rule out all the sensory components. The difficulty is when you come across a nerve which has both the components, that is sensory and motor. That is when you need to be a little bit careful. Right? So hope we are clear with this classification of cranial nerves. Now, if you say that we are clear with this, we will move on to the next. If you have any doubt at this point of time, please feel free to ask. Okay, you may not get a direct question on, okay, which of these nerve is sensory, which of these nerve is motor, right? But they can always give you the names of the functional component that are associated with the cranial nerves, and they can ask you to identify whether the functional components belong to a particular cranial nerve or not. Done? So this is regarding the classification of cranial nerves into sensory, motor, or both, that is mixed. So remember the mnemonic, some say marry money, but my brother says big brains matter most. The first letter of each word of this mnemonic stands for what type of nerve that we are talking about. Done? Right? Fine. So once we have learnt about this classification of cranial nerves, let's talk about the attachment of the cranial nerves. Fine. Now this is very important for you. And based on this, you have a lot of questions that have been asked in previous year questions. Okay. Site of attachment of cranial nerves by giving a cadaveric image is one commonly asked way of asking questions on cranial nerves. Okay. So you must thoroughly understand what are the sites of attachment of each of the cranial nerve, right? So what we'll do is we will begin with the attachment of the first cranial nerve and we will go till the last one. Now, I want you to focus on this very clearly because this could be an important MCQ for your next exam. Okay. Now, what is the first cranial nerve that we have, right? The first cranial nerve we have is located along this sulcus. Okay. Now, this sulcus is called as the olfactory sulcus. And what is lodged here, remember, is not a cranial nerve. I'll tell again, I'm telling again, this is not a cranial nerve because what we just saw, this is called as the olfactory tract. Okay, this is called as the olfactory tract. And remember, the olfactory nerve actually emerge from the roof of the nasal cavity. They pierce through the orbital plate or the ethmoidal plate of the cribriform. Then they enter into the cranial cavity. Okay. So what we have here is the olfactory tract, but olfactory nerve end in this tract. Okay. So they are considered to be attached to the forebrain. Okay. So we will write that olfactory tract is attached where? It is attached to the forebrain. Done? Now, the next cranial nerve that we have is the optic nerve. And where exactly do we have the optic nerve here? You can see the cut ends of the optic nerve. Right? So these are the cut ends of the optic nerve. So let's mark the optic nerves. This is the optic nerve that we are speaking about. So where exactly the optic nerve is attached? Optic nerve is also attached to the forebrain, right? So this is also attached to forebrain. So this is what we said. The first two cranial nerves are attached to forebrain. Now, which is the third cranial nerve? The third cranial nerve is the oculomotor nerve. Now, before we identify the oculomotor nerve, we must identify the different parts of the brainstem. Now, what we are looking at is the inferior surface of the brain, and in inferior surface of the brain, this is the region of the midbrain. Okay, so these are in fact the anterior part of the midbrain, also called as the cerebral peduncles. Okay, and what we see here, this is actually the interpeduncular fossa. Okay, so this is part of your midbrain, the anterior part of the midbrain. This is pons, and here what we have is, this is the medulla oblongata. Okay, now the third of the cranial nerve is the oculomotor nerve, right? So where exactly is the oculomotor nerve? We can actually see this thick nerve coming from the ventral surface of the midbrain or anterior surface of the midbrain. And what nerve is this? This is the oculomotor nerve. Okay, and where exactly oculomotor nerve is attached? Remember, midbrain. But what I want you to remember here is, it is attached to the ventral surface of the midbrain. Okay, remember, when we use any structure that are related to brain, we don't use anterior and posterior very often, but instead we use ventral and dorsal. Okay, so midbrain, ventral surface. I'll tell you why this is important. So this is regarding the third cranial nerve or the oculomotor nerve. Now, which is the fourth cranial nerve that we have? The fourth cranial nerve we have is the trochlear nerve, right? Now, where is trochlear nerve coming from? If I draw the trochlear nerve, let me show that in dotted line, and then it emerges, right? What do we mean by this? Okay, remember the trochlear nerve, right? The trochlear nerve is attached again to which part of the brain? It is also attached to midbrain, but important for us is to know that it is attached to the dorsal surface of the midbrain. And remember this important point, because this is very frequently asked in your exam. Okay, this is a possible MCQ. Which is the only cranial nerve that arises from the dorsal aspect of the brain? All cranial nerves except for trochlear nerve arises from ventral surface. Let it be any part of the brain, but trochlear nerve is the only cranial nerve that arises from the dorsal surface of the midbrain. Okay, now there is one more peculiarity associated with the trochlear nerve. Can you tell me what is one more peculiarity of the trochlear nerve apart from being this is the only cranial nerve that arises from the dorsal surface? What is the other peculiarity associated with the trochlear nerve? Can you take a guess? What is the peculiarity associated with the trochlear nerve apart from being the only nerve that arises from the dorsal surface? Remember, the other peculiarity I want you to remember is this is the slendest or the smallest of all the 12 pairs of cranial nerves that we have. Okay, so these are two peculiarities associated with the trochlear nerve. Right? Done. Now, once we have talked about the first four cranial nerves, which is the fifth cranial nerve that we have? The fifth cranial nerve that we have is the trigeminal nerve. And where exactly the trigeminal nerve is attached? Remember, trigeminal nerve is attached here to the ventral surface of the pons. Okay, so what we have here, this is the pons. Arising from the ventral surface, we have the trigeminal nerve. Fine. Now, what kind of nerve is your trigeminal nerve? Is it predominantly sensory, predominantly motor, or it is a mixed cranial nerve? Remember, it is a mixed cranial nerve and it has both a sensory component as well as motor component, right? Now, why is this important for us? Remember, there is a motor root that comes for the trigeminal nerve and there is a sensory root that comes for trigeminal nerve. Okay, so let's label them as, this is the motor root, okay, and this is the sensory root, right? So motor root of the trigeminal nerve, this is the sensory root of trigeminal nerve. Now why we should know this? Even this will be asked in your entrance exam. For example, let me ask you this question. If the line passes through the attachment of the sensory root of the cranial nerve, what are the clinical symptoms that might result in? Or if the knife passes through or injury passes through the motor root, what are the clinical symptoms you might experience? Fine. So question can be framed like this. That is why you should know this very specifically. Trigeminal nerve is a mixed cranial nerve. It arises by two distinct roots, motor root and sensory root. Okay, the motor root is always medial, okay, because this is important for one more cranial nerve that we will learn. So I want you to remember this M for M, okay. So motor root of the trigeminal nerve is present, how? It is present medially, and sensory root is present laterally. And what is the major function of trigeminal nerve? Trigeminal nerve is responsible for carrying the sensation from the entire head and neck region. Okay. Now, since it is responsible for carrying the sensation, this is its predominant function. So you have a larger sensory root and a smaller motor root. And remember, the function of the smaller motor root is to supply the muscles of mastication. To supply the muscles of mastication, then to supply the anterior belly of digastric, the mylohyoid muscle, all the muscles that develop from the first pharyngeal arch are basically innervated by this motor root of trigeminal nerve. Done? So this is regarding the fifth cranial nerve. What is the site of attachment? Then, what is the next cranial nerve that we have? The next cranial nerve that we have is the abducens nerve. Now, where exactly abducens nerve is attached? Can you tell me what is this area or this landmark is called now? Now, this entire thing is the medulla oblongata, right? Now, this entire thing is the pons. The area between the pons and the medulla. What do you call this as? This is called as pontomedullary junction. Right. Now, what nerves are attached to pontomedullary junction? Remember, three cranial nerves are attached here. What are these three cranial nerves? The first cranial nerve that we have is the abducens nerve. Okay. So, what is this? This is the abducens nerve. Right. So, where exactly the abducens nerve is attached? It is attached to pontomedullary junction. Right. Then, what is the next cranial nerve that we have? The next cranial nerve that we have is the facial nerve. Remember, facial nerve is also a mixed cranial nerve, and this also has two important roots. Now, what are these two roots? Remember, the first root we have is the motor root. So, let's call this as the motor root of the facial nerve, and then we have the sensory root. This is similar to trigeminal nerve. I want you to remember this. So what is this? This is the motor root, okay, of facial nerve, and this is the sensory root of facial nerve. Done. Now, what exactly is the difference between this and the trigeminal nerve? Remember, when we discussed about trigeminal nerve, we said the sensory root is larger. The motor root is smaller because the main function of trigeminal nerve is carrying sensation from the head and neck region. Whereas, in case of facial nerve, the motor root is larger, whereas the sensory root is smaller because the main function of facial nerve is to supply the muscles of face or all the muscles that are developed from the second pharyngeal arch. Right. So this is regarding the difference between the size of the two roots of the cranial nerve, trigeminal and facial. So depending on the predominant function, you get a thick root. But what is common for both nerves, as you can make out, the motor root is again medial. Why I am stressing so much on this is questions have been asked exactly on the site of attachment of the sensory root and motor root. So you must know which is medial, which is lateral. So always remember it as M for M. Motor root, medial. Okay, so this is how I want you to remember this. Okay, so this is regarding the facial nerve. Now, which is the 8th cranial nerve that we have? The 8th cranial nerve also arises from here, and the 8th cranial nerve we have here is the vestibulocochlear nerve. Right? So this is also attached to what area? This is also attached to pontomedullary junction. So these are the 3 cranial nerves that are attached to the pontomedullary junction. Fine. Now, remember why this is important again. In ENT, you can get question on which of the cranial nerves are induced or injured or affected in the acoustic neuroma. Okay. Now remember, these are the nerves that can be affected in the order of lateral to medial. Right. So this is regarding the site of attachment of 6th, 7th and 8th cranial nerve. Right, which are attached to pontomedullary junction. Now, what are the last 4 cranial nerves that we have? The last 4 cranial nerves that we have are the glossopharyngeal to hypoglossal nerve. Now, let's try to identify where exactly these cranial nerves are attached. In order to understand this, what we must know is the structures which are seen on the ventral surface of the medulla. Okay. Now, in the medulla oblongata, we have 2 elevations. This is called as pyramid. I'll just write it in a different color. So this elevation is called as pyramid. Okay. If you recall, the pyramids are formed by the descending corticospinal tracts. Okay. So this is the pyramid. Okay. Then we have one more elevation, and this elevation is called as olive. Right. Then one more elevation we have here. This is called as the inferior cerebellar peduncle, which connects the cerebellum to the medulla oblongata. Now, why we are stressing so much on this? In between these 3 swellings, we have 2 distinct sulci. Now, what are these sulci? So, one we have as the anterolateral sulcus, which is between the pyramid and the olive. And then here we have the posterolateral sulcus, which is between the olive and the inferior cerebellar peduncle. Now, please remember, when we talk about the cranial nerves here, so what we have on the posterolateral sulcus, right? So first, let's talk about the attachment to the posterolateral sulcus here. So here we have 3 important cranial nerves. Okay. Now, what are these cranial nerves? Remember, this is your 9th, which is the glossopharyngeal nerve. This is the 10th or the vagus. And this is the cranial root of accessory nerve. Okay. Remember, the accessory nerve is said to have 2 important roots. One is the spinal root and the other one is the cranial root. The cranial root is attached to the medulla, whereas the spinal root or the spinal part of the accessory nerve comes from the upper 5 cervical spinal segments. It is actually attached to spinal cord. This is one more peculiarity associated with the accessory nerve. Okay. Accessory nerve has 2 parts. One part which arises from the brain itself and one root which actually arises from the spinal cord. Only cranial nerve which has its root arising from the spinal cord, the spinal root of accessory nerve. Right. So this is the posterolateral sulcus. Whereas here attached to the anterolateral sulcus, what do we have? We have the hypoglossal nerve. Done. The rootlets of hypoglossal nerve. Now, this is what you must know with respect to the site of attachment of cranial nerves, right? For example, if the injury occurs in the anterolateral sulcus, what cranial nerve is injured? And if injury occurs in posterolateral sulcus, what cranial nerve is injured? This is what you must know, right? So this is regarding the site of attachment of cranial nerves, right? And one more peculiarity I just wanted to highlight for the abducens nerve. Okay. The trochlear nerve is the only cranial nerve which has or its origin from the dorsal aspect. It arises from the dorsal aspect of the brainstem. I told you this is the only cranial nerve that arises from dorsal aspect. But apart from this, one more important peculiarity associated with abducens nerve is this nerve has the longest intracranial course. Okay, this has also been asked as a PYQ. Okay, this also has been asked as a previous year question where they've asked which of the following cranial nerves has the longest intracranial course, or which of the following nerve is affected by a growing tumor. Right? Because of its long intracranial course, abducens nerve is very susceptible to tumorous growth. Okay, fine. So this is regarding the site of attachment of cranial nerves. Done. Now at this point of time, before we proceed, if you have any doubts, you can ask me. So we will clarify that and we will move on to the next topic or the next section. Any question related to whatever we have discussed till now? Done. So what we'll do is, once we have learnt about the site of attachment of cranial nerves, the next important thing that we must learn in detail is how exactly each cranial nerve either enter the skull or exit the skull. Okay, so this again comes back to foramina of the skull, which is also one more frequently asked topic from the gross anatomy. Okay, so for each of the cranial nerves, we will try to understand that. Okay, very recently there was a question on how the COVID-19 virus actually spreads through a cranial nerve into the cranial cavity. Okay, we'll try to answer that once we discuss about the cranial nerves, how exactly do they enter or leave the skull. Now remember, when I say they exit the skull or they enter the skull, what do I mean by it? Remember, the entry or entering of cranial nerves refer to sensory cranial nerves. For example, olfactory nerve. Olfactory nerve never exits the skull, but it actually enters the skull. And similarly, exit means the motor nerves or the motor cranial nerves. Done. Right. Now, let's talk about all the cranial nerves in detail now. So what you see in the image is the cranial cavity as seen from inside. Okay. First, which is the first cranial nerve that we have? We have the olfactory nerve. Now, let's try to learn how exactly olfactory nerve enters the skull. Okay. Remember, olfactory nerve enters the skull by passing through this bone. Now, what is this bone? Remember, this bone is the cribriform plate of ethmoid. Okay, so this is the cribriform plate of ethmoid through which olfactory nerve enters the skull. And this was the question I was talking about. Okay, in INI-CET exam, there was a question where they asked how exactly COVID-19 virus can enter the cranial cavity. They had given multiple foramina as the options. So the only option we can think of is it can spread through your olfactory nerve through the cribriform plate of ethmoid. And this is the reason why you must know how exactly each cranial nerve will either enter the skull or exit the skull. So this is regarding the first cranial nerve. Now what is the next cranial nerve that we have? The next cranial nerve that we have is the optic nerve. How exactly optic nerve enters the skull? Remember, optic nerve is also a sensory nerve. Now, optic nerve enters through this opening. Now, what is this opening that we have? This is the optic canal. Right? Optic nerve along with the central artery of retina passes through this optic canal. Fine. So, one is to know how the cranial nerves enter or exit the skull. Again, the other thing to know is what are the other structures that can pass through this opening or the canals. So optic canal, remember optic nerve. Along with optic nerve, you also have the central artery of retina. Right? Now, at this point of time, can you tell me what exactly is the peculiarity of the central artery of retina that passes through the optic nerve? Think back to your general anatomy and tell me what exactly is the peculiarity of the central artery of retina. What kind of artery it is and why it is clinically important. What type of artery is the central artery of retina? Remember, central artery of retina is an example for the end artery. End arteries are those which do not have a pre-capillary anastomosis. Any occlusion to such arteries will invariably lead to death of a particular tissue. Right? So this is regarding the peculiarity of the central artery of retina. Right? Now, what is the third cranial nerve that we have? The third cranial nerve we have is the oculomotor nerve. Right? The third, yes, Ved Prakash, you're correct. Central artery of retina is an example for the end artery. In fact, it's an example for true anatomical end artery. Functional end arteries are seen with the coronary arteries or the cerebral arteries, right? Whereas the central artery of retina is an example for end artery. Very well said, Ved Prakash, right? So, oculomotor nerve. How exactly oculomotor nerve leaves the skull? Remember, oculomotor nerve is a motor nerve, right? So, it has to leave the skull to supply its target structures. In order to understand the oculomotor nerve, now the function of oculomotor nerve is to supply extraocular muscles, right? Now, if it has to supply the extraocular muscles, it has to enter the orbit. Now, how does the oculomotor nerve enter the orbit? Remember, it can enter the orbit by passing through superior orbital fissure, right? Now, if we just recall the anatomy of the superior orbital fissure, it is a retort-shaped gap which is present at the apex of the orbit. And this is bounded by the greater wing of the sphenoid and the lesser wing of the sphenoid. And it is divided into three parts by the tendinous ring of Zinn. Right? Now, in the superolateral compartment, so we call this as the superolateral compartment, this as the intermediate compartment, and this as the inferomedial compartment. Now, what are the nerves that pass through this? Again, remember, we can relate it back to cranial nerve. So that's why I'm going a little bit in deep. So here we have the LFT. Okay. We remember this as LFT, right? Now, what does LFT stand for? The lacrimal nerve, frontal nerve, and trochlear nerve. So this is important for us. So what is this? The trochlear nerve. Fine. So this is the fourth cranial nerve. Then the intermediate compartment allows for the passage of two nerves. These are the superior ramus of the third cranial nerve, and let's say this is the inferior ramus of the third cranial nerve. The oculomotor nerve divides into two branches, ramus, branch. Okay, so superior ramus and inferior ramus, and these are branches from oculomotor nerve. So oculomotor nerve is what we were talking. So how exactly oculomotor nerve leaves the skull? Remember, it is through superior orbital fissure. Which compartment? The middle compartment or the intermediate compartment. Done. And where is superior orbital fissure? The superior orbital fissure is located right under this bone. Now, can you tell me what is this bone? Because this is also one frequently asked question, especially when it comes to pterion. Okay. Now, I want you to remember that this bone is the lesser wing of sphenoid. Okay. Located right beneath the lesser wing of the sphenoid, we have the superior orbital fissure. So, if you take this as the example, this is the lesser wing of sphenoid, right? And this is the greater wing. Okay. So, why I am telling you this is located exactly here, you have the pterion. And what is pterion? Pterion is a landmark seen on the lateral side of your skull where four bones meet. What are the four bones? We have the frontal, we have the temporal, we have the parietal, and we have the sphenoid bone, right? Its clinical importance is deep to the pterion lies middle meningeal artery. To be more specific, anterior division of middle meningeal artery. And this has been asked a lot of times as a PYQ. Okay, both in your INI-CET as well as NEET exam. What is pterion? What structure is related to it? So remember, anterior division of middle meningeal artery. But one more difficult question which was asked related to pterion was, what structure is related? What bony structure is related to the inside of the pterion? And remember, the answer is the lesser wing of the sphenoid. So if you locate the pterion, this is where the pterion can be located on the exterior. Right? So why did we talk about this? Because we spoke about where exactly superior orbital fissure is located. Remember, it is located right beneath the lesser wing of the sphenoid. So superior orbital fissure is basically bounded between the lesser wing of the sphenoid above and the greater wing of the sphenoid below. Then, which is the fourth cranial nerve? The fourth cranial nerve we have discussed here. And how does trochlear nerve will leave the skull? Trochlear nerve will leave the skull again through what? The superior orbital fissure, but which compartment? The lateral compartment or the superolateral compartment. Right. Then, which is the next cranial nerve that we have? We have the trigeminal nerve. Okay. Now, when we talk about trigeminal nerve, we know that trigeminal nerve has three subdivisions. What are the three subdivisions we have? We have the ophthalmic nerve, then we have the maxillary nerve, and then we have the mandibular nerve. Right? How exactly each of these subdivisions of trigeminal nerve will enter or leave the skull? Okay, so we are talking about ophthalmic nerve. Remember, ophthalmic nerve further splits into three branches: lacrimal, frontal, and nasociliary. So we have already learnt about the lacrimal nerve. Okay, lacrimal nerve and frontal nerve. Where are they passing? They are passing through the superolateral compartment of superior orbital fissure. Which is the next important subdivision? Nasociliary nerve. Now, where exactly nasociliary nerve is located? This is the nasociliary nerve. Right? This is the nasociliary nerve. The nasociliary nerve passes through the intermediate compartment or the middle compartment. Then, the next cranial nerve that we have is the abducens nerve. How does abducens nerve enter or leave the skull? Abducens nerve is a motor nerve. So remember, this leaves the skull through the intermediate compartment of the superior orbital fissure. Okay. So here we have the abducens nerve. Done. So this is why you should know a little bit in detail about the superior orbital fissure. Because superior orbital fissure will allow for the passage of third, fourth, three subdivisions of the fifth cranial nerve. Then it also allows for the passage of the abducens nerve or the sixth cranial nerve. Done. So once we have learned this, let's talk about the last six cranial nerves, where exactly they pass. Now in trigeminal nerve, we learnt about the ophthalmic nerve. What about maxillary nerve and mandibular nerve? Remember what foramen we have here? This foramen is called as foramen ovale, and this is foramen spinosum. Anterior to foramen ovale, located here, we have one foramen, and this foramen is called as foramen rotundum. Okay, foramen rotundum will allow for the passage of maxillary nerve, whereas foramen ovale will allow for the passage of mandibular nerve. So trigeminal nerve has three subdivisions. Ophthalmic nerve entirely passes through superior orbital fissure by dividing into lacrimal, frontal, and nasociliary. Whereas the maxillary nerve will enter the skull through foramen rotundum. Mandibular nerve will leave the skull through foramen ovale. Then what about the next cranial nerves that we have? Remember, we have the next cranial nerve as facial nerve. Now where exactly the facial nerve is going? Remember, the facial nerve enters through this opening. Okay. Now what is this opening? This opening is called as internal acoustic meatus. Right? Internal acoustic meatus allows for the passage of two cranial nerves. What are they? The facial nerve as well as the vestibulocochlear nerve. With the facial nerve, we need to be a little bit careful because facial nerve is a mixed nerve. So it has both sensory component and motor component, right? Even though facial nerve enters through the internal acoustic meatus, it never leaves the skull through this. Once it enters the internal acoustic meatus, it traverses through the middle ear, and then what happens to this cranial nerve is it comes out through a foramen called as stylomastoid foramen. Okay, it comes out through stylomastoid foramen. Right? Then what about 9th, 10th and 11th cranial nerves? So what we'll do is we'll just use this template again, and we will talk about the last of the 4 cranial nerves. Right? Now, can you tell me what foramen is this? Can you recognize this foramen? We said the opening that we see here is the internal acoustic meatus. Now, can you tell me what foramen am I talking about, which lies directly below the internal acoustic meatus? The clue is this is the foramen through which all the 9th, 10th and 11th cranial nerve will emerge out. Okay, so can you tell me what foramen is I'm pointing to? What is the name of this foramen? Yeah, can you just give a try? What foramen is this, which allows for the passage of 9th, 10th and 11th cranial nerve, and which is part of your posterior cranial fossa? Remember, this foramen is the jugular foramen, right? So this is called as the jugular foramen. Very good, Apurva, right? Yeah, correct, Sneha. So this is jugular foramen. Correct, Rajneesh, Rahul. So this is the jugular foramen, right? Now remember, jugular foramen will allow for the passage of 9th, 10th and 11th cranial nerve. Okay, 9th, 10th and 11th cranial nerve, all of them pass through jugular foramen. Now, on the jugular foramen, you had 2 important questions. Okay, now one of the question was, out of these 3 cranial nerves, which cranial nerve passes through a separate canal? We know that 9th, 10th and 11th cranial nerve, all of them pass through jugular foramen. But remember, one of the peculiarity of the 9th cranial nerve, sorry, not the vagus, the 9th cranial nerve is, or the glossopharyngeal nerve is, this has a separate dural sheath. Even though it passes through the jugular foramen, it has a separate dural sheath. So it does look like the entire nerve passes through a separate canal. So this was one question which was asked. Out of glossopharyngeal nerve, vagus nerve and axillary nerve, which nerve actually passes through the separate dural canal or separate canal? So remember, it is the glossopharyngeal nerve. The second question that was asked was, if a fracture passes through this line, right? If a fracture passes through the jugular foramen, which part of the tongue will lose sensation and what kind of sensation will be lost? Okay. Now, if the fracture occurs through jugular foramen, it is, or it will definitely injure the glossopharyngeal nerve. It will definitely injure the vagus nerve. If you recall the nerve supply of the tongue, okay, the anterior 2/3 of the tongue is supplied by lingual nerve, which carries the general sensation, and the chorda tympani will carry the taste sensation, right? Except for circumvallate papilla. Remember, even though circumvallate papilla is present in the anterior 2/3, the sensation is basically carried by the glossopharyngeal nerve, right? Now, what happens if the glossopharyngeal nerve or vagus nerve both are injured? Remember, both general sense as well as taste sense from the posterior 1/3 and also the posterior most part of the tongue is affected. Yes, Rajneesh, you're absolutely correct. If the jugular foramen is fractured, and if you are asked what effect does it have on the sensation carried from the tongue, there is complete loss of both general sensation as well as taste sensation from the posterior 1/3 and the posterior most part of the tongue. Okay, these 2 questions have been asked very frequently, right? So the image-based question where they will give you a pointed foramen and they will ask you what nerve passes through a separate canal through the pointed foramen. The second question which I just told you was, if a fracture of the skull passes through jugular foramen, what is the effect of this on the sensation carried from the tongue? That is why you must know in detail regarding jugular foramen. Right. Now, if you are talking about jugular foramen, the other thing you must know here is jugular foramen allows for the passage of two important dural venous sinuses. Okay. Now, what are these dural venous sinuses? One is the inferior petrosal sinus and the other one is the sigmoid sinus. Now, why I'm talking about this is sigmoid sinus will ultimately continue as your internal jugular vein, and inferior petrosal sinus is often considered as the first tributary of the internal jugular vein. Right? So with the jugular foramen, you have all these structures passing out. Right? Then the last of the cranial nerve that we have is the hypoglossal nerve. Now, how exactly the hypoglossal nerve will enter or leave the skull? I want you to take a look at this foramen, which is present just above the foramen magnum. Now, what is this foramen that we are talking about? This is the foramen which is called as the hypoglossal canal. Now, what nerve passes through the hypoglossal canal? As the name suggests, the hypoglossal nerve. Okay, so this is regarding the last of the cranial nerve, right? Now, this is what I said. You must thoroughly know how exactly all the 12 cranial nerves either enter the skull or exit the skull. So what you get as questions now is, they will mark the foramina and they will ask you a clinical symptom associated with asking you which cranial nerve is affected. Okay, so knowing all the 12 cranial nerves, how exactly they enter or exit the skull, and where exactly all the foramina of the skull are located is very essential. Fine. So this is regarding the entry and exit of cranial nerves. Done. Now, if we are through with the entry and exit of cranial nerves, one more important topic I want to discuss before we close is how exactly the functional components of the cranial nerves are arranged and where exactly these are located. Fine. Now, why did I choose this topic again, the functional components or the cranial nerves? As I said, we get a lot of questions on the location of the functional components. What are the 7 functional components that we have, and where exactly, in which part of the brainstem these functional components are located, and which cranial nerve has these functional components, what are the nuclei associated with it, and how do we classify it according to the cranial nerves that we study. Now, this is like very frequently asked in your entrance exam, so that's one reason. And if you're studying your first year, this is one topic that you often skip, right? You don't give too much importance on studying or learning the functional components of cranial nerves, because we always feel that this is a little bit complex to understand, right? But if we understand the organization of the neural tube, right, the development of the nervous system, it becomes a lot more easier to understand the concept of the functional components of cranial nerves. And that is what we'll try to do in the next few minutes. We'll try to discuss about the functional components of cranial nerves, what exactly they are, what do we mean by a nuclei, what do we mean by a column, and what are the different cranial nerve nuclei associated with each of these functional columns. Okay, Himanshu is asking a question, what you told about circumvallate papilla. Himanshu, just to get back to that, now if you are talking about, let's say, the entire tongue, in jugular foramen, right? So we'll talk about it. Now let's imagine like we are talking about the tongue as such, and we know that we have the foramen cecum dividing the tongue, the sulcus terminalis dividing the tongue into anterior 1/3, and we have let's say this is the posterior 1/3, and here we have the posterior most part of the tongue, right? Now, if we study the location of the the circumvallate papilla, this is where we have the location of circumvallate papilla, right? They are located exactly in front of the sulcus terminalis, right? So they are basically present in the anterior two-third. But when we talk about how exactly the sensation are carried from the anterior two-third, we have general sensation and we have taste sensation. The general sensation is carried by the lingual nerve, whereas the taste sensation is carried by the chorda tympani. Okay, we know that chorda tympani is a branch of facial nerve, right? But even though the circumvallate papilla are present in the anterior two-thirds of the tongue, the sensation from the circumvallate papilla are actually carried by the glossopharyngeal nerve. Okay, so this is one thing that we often miss when we study the nerve supply of the tongue. So even though glossopharyngeal papilla are situated in the anterior two-thirds of the tongue, it is still, the sensations are still carried by glossopharyngeal nerve. That was one thing, right? I hope that part is clear, Himanshu. Like circumvallate papilla, they are not, sensation are not carried by chorda tympani, taste sensation are carried by the glossopharyngeal nerve. The other thing I was talking about was, now if you see this as the section of the jugula foramen, okay, I told you jugula foramen has a dural venous sinus, let's say that is the sigmoid sinus, and let's say here we have the inferior petrosal sinus, right? In between we have three cranial nerves. Okay, now what are these cranial nerves? Let's say we have the glossopharyngeal nerve, vagus nerve, and then the spinal root of axillary nerve, right? So what is this? This is the ninth cranial nerve or the glossopharyngeal nerve. This is the vagus nerve, and this is the cranial root of axillary nerve. Okay, not spinal, cranial root. Now the entire glossopharyngeal nerve is surrounded by a separate dural sheath. So even though it is present in jugula foramen, it is as though there is one canal is present inside the jugula foramen. So your glossopharyngeal nerve is separated from the sigmoid sinus and the vagus nerve by a separate dural sheath, which is seen as a canal. Okay, so that's what I meant, right? So glossopharyngeal nerve, even though it passes through jugula foramen, it has a separate dural sheath through which it passes out. That was the meaning, right? Himanshu, is it clear now? Okay, Himanshu, I hope I've answered your doubt. If it's clear, you can just drop in a message in the chat box. Okay, so we will continue with the topics that we were discussing regarding the cranial nerves, and as I mentioned, we will talk now about the anatomy of the functional components of cranial nerves. Right now, in order to understand the Himanshu, circumvallate papilla is ninth nerve for both taste and general. Himanshu, it has the taste sensation. Okay, the general sensation are still carried by the lingual nerve. The general sensation is carried by the lingual nerve, but the taste sensation is carried by the glossopharyngeal nerve. Right? Hope this is clear now. Okay, now in order to understand the anatomy of functional components of the cranial nerves, we must know little bit of development of the neural tube, right, or the brain vesicles. Okay, the entire central nervous system is developed from the neuroectoderm, which is a part of your ectoderm, right? Now the entire neural tube is organized as, it has brain vesicles. Okay, it has three brain vesicles and it has a cylindrical part. Okay, so this is called as the prosencephalon, this is the mesencephalon, and this is the rhombencephalon. Whereas this caudal part of the neural tube, okay, so this is the caudal part of neural tube which divides or which develops into spinal cord. Right, now the prosencephalon will further undergo subdivision to form the telencephalon, which will give rise to cerebral hemisphere, and diencephalon, which will give rise to the thalamus and the associated structure. Whereas mesencephalon will persist as the midbrain, whereas rhombencephalon will ultimately develop into metencephalon and myelencephalon. Okay, metencephalon gives rise to pons and cerebellum, myelencephalon gives rise to the medulla oblongata. Now, why we are discussing this? Remember, when we talk about functional components of cranial nerves, right? The functional components of cranial nerves are associated with nerves that are attached to the brainstem. Okay, so they are the nerves attached to brainstem only. And brainstem, we know that. What does it include? It includes the pons, the midbrain, pons, and medulla oblongata. Okay, and the pons, midbrain, and medulla oblongata develop from the mesencephalon and the rhombencephalon. Now, this is the first thing we need to understand, right? We don't have cranial nerve nuclei associated with the optic nerve or the olfactory nerve. The cranial nerve nuclei are associated starting from the oculomotor nerve till we talk about the hypoglossal nerve. Okay, this is the importance, right? So this is little bit about the brain vesicles, their subdivisions, and what are the structures derived from these brain vesicles. So remember, we talk about only these two parts of the brain vesicles, that is mesencephalon and rhombencephalon. Okay, now if we try to understand the development of the neural tube, imagine I take a section here. I take a section at, let's say, the rhombencephalon, okay, which will split into metencephalon and myelencephalon. How exactly does it look? It looks like it has a lumen in the center, okay, and then it has a wall. Remember, the lumen will develop into the cavities of the brain like ventricles or the central canal of the spinal cord. But what is important for us is this thickness or this wall of the neural tube. Right. Now, what happens with further development of the neural tube is we have the development of a groove called as sulcus limitans. Okay. Now, this sulcus limitans appears converting the round central canal or round cavity of the neural tube into a rhomboid shaped cavity. So then we have this as the wall of the neural tube. Right. Appearance of this sulcus limitans will divide your neural tube into two parts. Okay. Now, what are the two parts? The ventral part and the dorsal part. Okay. So this is called as the ventral part and this is the dorsal part. Now, if you recall the anatomy of the spinal cord, we know that the dorsal part of the spinal cord is sensory, whereas the ventral part is motor. The same happens here. Okay, so what we have here is this is the efferent component or the anterior part of the neural tube will have aggregation of motor neurons, whereas the dorsal part will have aggregation of afferent neurons or sensory neurons. Right, so this is regarding the subdivision of the neural tube into an anterior or ventral motor part or efferent part and dorsal afferent part. Right, fine. Now, what happens further? With the development of the sulcus limitans and appearance of this groove, the neurons start getting aggregated together. Okay, this leads to development of nuclei, and nuclei, remember, is localized aggregation of cell bodies of neurons. When you see the arrangement of nuclei in a single line or as a column, you call it as functional column. Okay, so what happens in the next stage is quite interesting. We have the same rhomboid shaped central canal, let's say, and we have the neural tube, right? And we know that it is divided into two parts now, the ventral part and dorsal part. Okay, so the neurons start getting aggregated here. So we will draw the efferent neurons in a different color. So let's say this is one group of efferent neuron and this is one group of efferent neuron. Similarly, we have an afferent neuron here and an afferent neuron here. Done. Now, what exactly is these neuron representing? Remember, we have this is the efferent column and this is also efferent column. So why do you have two efferent columns? Now, the function of efferent neuron is to supply a target organ, but why there need to be two different sets? Remember, the efferent neuron which is close to sulcus limitans is always mentioned as visceral. And the one which is away from the sulcus limitans is always numbered or named as somatic. What do you mean by somatic efferent and visceral efferent? Somatic structures are those which develop from the paraxial mesoderm or the somites. For example, the body wall, the muscles of the body wall, right? The dermis. All these are derived from paraxial mesoderm, and structures which are supplied from paraxial mesoderm is what we refer to as somatic efferent. What do we mean by visceral efferent? Remember, whenever you use the term visceral efferent, it applies for three structures. Ultimately, all visceral efferent neurons will supply only three structures. What are these? Remember, these are smooth muscle and cardiac muscle or glands. Okay, smooth muscle, cardiac muscle or glands. So basically, when we have visceral efferent component, okay, this supplies these two or these three components. Done. So now we have visceral efferent and somatic efferent column, right? Similarly, posteriorly, what we will have? Visceral afferent column, which carries the sensation from smooth muscle, cardiac muscle or glands. And then here we have the somatic afferent. So remember, whenever you have the term V, this has to be present close to sulcus limitans. Again, you might ask me why this is important. Even this has been asked as an MCQ. Which functional column is close to sulcus limitans? So always remember, the column which is close to sulcus limitans is always visceral column. It should have V in it. Okay. Now, we know that these functional columns are usually named as like general somatic efferent or general visceral efferent, like this. So what we will do now is we will add one more letter now. So this is the general visceral efferent column. What is the function of the general visceral efferent column? It forms the autonomic nervous system which supplies smooth muscle, cardiac muscle or glands. Right. What about general somatic efferent column? This column supplies all the structures that develop from somites. Done. Right. Now, let's add the same two afferent columns. So we have general visceral afferent column and general somatic afferent column. What is general visceral afferent column? It will carry sensation back from smooth muscle, cardiac muscle or glands. That's it. Right. Then what do we have? The other column, general somatic efferent. This column carries sensations. Okay. Sensation that develop from the skin. Right. So that is general somatic afferent column. So how many functional columns we have now? We have 4 functional columns, 2 efferent and 2 afferent. Now, with the subsequent development of the neural tube, 2 important changes occur. Now, what is the change that occurs? Remember, one is enlargement of the brain vesicle. Okay, both the metencephalon and the myelencephalon part. The other change that appears is, with this, there is also appearance of the branchial arches. So there are a lot of structures that develop from branchial arches which need a separate set of neurons. Right. Now this neurons will give rise to one more additional column. So we shall see. So first change, as I told you, was this neural tube developing and expanding. And when it expands, how does it look is, imagine if you cut here and split the neural tube open like this. Okay. And why this occurs? This is because this cavity of the rhombencephalon will enlarge to form the 4th ventricle. So appearance of the 4th ventricle will cause enormous enlargement of the rhombencephalon, splitting it open like or splaying it open like a book. So what will happen now is you have this orientation of the neural tube. So the neural tube basically looks like this. This is sulcus limitans, right? So this is how the neural tube looks now. And this is the cavity of, let's say, the 4th ventricle, right? Since this is the sulcus limitans we are talking about, let's try to draw the same. So what functional column are these? This is general visceral efferent. So always remember visceral column close to sulcus limitans. This is general somatic efferent. And what do we have here? This is general visceral afferent. And what do we have here? This is general somatic afferent. Right. So what I told is, with the appearance of branchial arches, you have one more column appearing. Right. And what is this column? This column is called as the special visceral column. Okay. So let's draw a column here. So one column is appearing here. And what do we call this as? Special visceral column. And since it is appearing in the efferent part, we will call this as special visceral efferent column. Done. Similarly, we have one more column appearing here. Right. And let's call this as special visceral afferent. Right. So whenever you use the term special visceral, always remember special visceral refers to structures derived from the branchial arches. Right. So this is the meaning of special visceral. Right. Now, these are the 6 functional columns we have. In addition to this, the afferent column has one more important column appearing, and let's label that as, we will just draw it in a different color. So we will call this as special somatic afferent column. The function of this column is pretty simple. It carries the fibers from the vestibulocochlear nerve. So this column is entirely dedicated to the vestibulocochlear nerve, the sensation of hearing and equilibrium and nothing else. Right? So this is how the 7 functional columns make their appearance. So once you know the meaning of these columns, it is very easy to derive the nuclei that are associated with it. Okay? So let's try to learn a little bit about the development of these functional columns. Okay? So what we'll do is, we'll try to use a tabular column where we will learn each of the functional component along with their nucleus associated and which part of the brainstem they are located. For example, let's imagine we have the midbrain here. Okay, then we have the pons, and then we have the medulla oblongata. Okay, now let's try to draw the outline of the brainstem that we were discussing. We will draw for like one side of it. So let's imagine this is the efferent column, right? And in efferent column we had how many nuclei? So let's say this is general visceral efferent, and what is this? General somatic efferent, and the middle one that we showed, this is special visceral efferent column. Similarly, the afferent columns were general visceral afferent. Here we had the general somatic afferent. Then we had the special visceral afferent, and one more column we had here was special somatic afferent column. Right. So let's take this as the sulcus limitans. Okay. So this is the sulcus limitans. So let's write down the column. So general somatic efferent, we'll use the same color so that it's not confusing. So general somatic efferent, general visceral efferent, then we have special visceral efferent. Here we have the general visceral afferent, and we know that, or I'll tell you that this is a single column, and then we have general somatic afferent, and then we have special somatic afferent column. Right. So each of this functional column has a nucleus associated with it, and then it is located in a part of your brainstem. For example, let's talk about general somatic efferent column. What is the definition of general somatic efferent column? General somatic efferent column supplies the structures which are derived from the paraxial mesoderm, which gives rise to somites. Now, let's think of what muscles in your head and neck are developed from somites, and they derive their nerve supply from the general somatic efferent column. Okay, these muscles are represented by the extraocular muscles, okay, apart from extraocular muscles, we have the muscles of the tongue. Right? Now, before we go further, can you tell me how or what cranial nerves supply your extraocular muscles? Remember, we have 4 recti, right? Superior, medial, lateral, inferior, then 2 obliques, superior and inferior oblique, and also levator palpebrae superioris, right? Now, how exactly or what cranial nerves supply these extraocular muscles? Can you quickly tell me the number of these cranial nerves, and we will derive the functional column associated with each of these cranial nerves. So, what cranial nerves actually supply the structures derived from the cranial somites or the extraocular muscles I'm talking. So can you name the cranial nerves so that we will list down what are the nucleus related to it? If you are talking about, let's say, medial rectus or superior rectus, what nerve supplies it? What are the cranial nerves supplying these extraocular muscles? Remember, if you are talking about extraocular muscles, only 3 nerves can actually supply it. Okay, these 3 nerves are oculomotor nerve, trochlear nerve, and then abducens nerve. So each of these cranial nerve will have their own nucleus. For example, we have the oculomotor nucleus for the oculomotor nerve, the motor nucleus of trochlear nerve, or the motor nucleus of abducens nerve. Right? So let's try to draw them. The first nucleus we have is the oculomotor nucleus. Okay, so let's call this as oculomotor nucleus. Oculomotor nucleus is located in midbrain. Then the other nucleus we have is the trochlear nucleus. Okay, so both nuclei belong to general somatic efferent column and both of them are located in midbrain. Now try to recall the attachment of the cranial nerves. We have seen that the oculomotor nerve and the trochlear nerve, both of them, they are attached where? They are attached to the midbrain. Right? So these are the 2 nuclei. Then in the pons, you have one more nucleus, and that nucleus is your abducens nucleus. Okay? Which gives rise to fibers which supply the lateral rectus muscle. Then the cranial somites not only give rise to extraocular muscles, but they also give rise to the tongue muscles. And we know that the tongue muscles are supplied by hypoglossal nerve, except for palatoglossus. So what is the nucleus that we expect here? We can write the hypoglossal nucleus. So general somatic efferent column has 4 important nuclei related to 4 important cranial nerves. Okay, these are oculomotor nerve, trochlear nerve, abducent nerve, and hypoglossal nerve. The oculomotor nerve and trochlear nucleus is located in the midbrain. The abducent nucleus is located in the pons, and the hypoglossal nucleus is located in medulla oblongata. Done? Right. Then what about the special visceral efferent column? Remember, what is the function of the special visceral efferent column? We said special visceral efferent column supplies the muscles derived from branchial arches. Right. Now, what about these nuclei? So let's talk about the nuclei here. The midbrain will have no nucleus representing it. Okay. Whereas in the pons, we have 2 nuclei. One is called as the motor nucleus of the trigeminal nerve. Okay. And the other one is the motor nucleus of the facial nerve. Now, why do we say that these are the 2 nuclei? Remember, we have the muscles of mastication that develop from first pharyngeal arch. And what is the nerve of the first pharyngeal arch? It is the mandibular nerve. And we know that mandibular nerve is in turn a branch of trigeminal nerve. So the nucleus that gives rise to fibers supplying muscles of mastication is the motor nucleus of trigeminal nerve. Right? Then the facial muscles are derived from second pharyngeal arch. They are supplied by facial nerve. So you have the motor nucleus of facial nerve. Done. Then we have the muscle of the third pharyngeal arch, which is glossopharyngeal nerve. Muscle of the fourth and sixth arch are the muscles of your larynx and pharynx, which are basically supplied by the cranial part of the axillary nerve through the vagus. Right. So what we have is one common nucleus which supply this stylopharyngeus muscle and all the muscles of the larynx and pharynx, and that nucleus is called as the nucleus ambiguus. Okay, so this is called as nucleus ambiguous, and this is common to 9th, 10th and 11th cranial nerve. Fine. So this is regarding the special visceral efferent column. Okay, so remember, all these nuclei will exclusively supply the muscles that develop from the pharyngeal arches. Done. Then what about general visceral efferent column? We said general visceral efferent column will supply the structures that develop or that include three structures only, which are cardiac muscle, smooth muscle and glands. Okay, now let's think about smooth muscles which are present in your head and neck region. What smooth muscles are present in your head and neck region that actually requires innervation? Remember, these are your sphincter pupillae and dilator pupillae. Right. Now, these sphincter pupillae are supplied by one important nucleus of your oculomotor nerve, and that is called as the Edinger-Westphal nucleus. Okay, what is the function of Edinger-Westphal nucleus? The Edinger-Westphal nucleus will ultimately innervate the sphincter pupillae through the oculomotor nerve. This is regarding one of the smooth muscle. Right. Then, what about the glands present in the head and neck region? We know that we have the salivary glands, right? We have the parotid gland, then we have the submandibular salivary gland and the sublingual salivary gland. Now, these are also controlled by few nuclei. Now, what are these nuclei? Remember, one nuclei we have in the pons is we have the superior salivatory nucleus. What is the function of superior salivatory nucleus? This gives rise to secretomotor fibers that control salivary secretion from the submandibular salivary gland and the sublingual salivary gland. Done? Then the next important nuclei we have in the medulla oblongata is the inferior salivatory nucleus. The inferior salivatory nucleus actually carries secretomotor fibers from the nucleus to the parotid gland. Right? Apart from this, we have a nucleus called as the dorsal nucleus of vagus. So we call this as dorsal nucleus of vagus. And that is also one more important nuclei or nucleus associated with general visceral efferent column. Now you might ask why dorsal nucleus of the vagus is important, because you already have one nucleus here. Remember, the fibers that come from nucleus ambiguus will supply the muscles of the larynx or pharynx, whereas the fibers that come from dorsal nucleus of the vagus are autonomic fibers which supply the smooth muscles present in all the blood vessels. Then it also supplies all the smooth muscles present in your GIT. Then it also supplies the cardiac muscles. That is why I said general visceral efferent column supplies smooth muscle, cardiac muscle or glands. So this is regarding the efferent column, and these are the nuclei associated with each of the efferent column. Done? Right. So once we have learned this, let's talk about the general visceral afferent column. Now, general visceral afferent column and special visceral afferent column has a separate set of nucleus. Sorry. This nucleus is called as, it's actually a U-shaped nucleus, right? And this U-shaped nucleus we have is called as nucleus tractus solitarius. Okay. Nucleus tractus solitarius is present in the medulla oblongata, as we can see, and this carries both general sensation and taste sensation from the three parts of the tongue. That is why I said there are two functional columns associated with this nucleus. So both general sensation from the viscera, the smooth muscle, cardiac muscle or glands, and taste sensation from the tongue, all of this are carried into nucleus tractus solitarius. Done? Right. So this is regarding one important functional column. Then what about general somatic afferent column? This contains nuclei or nucleus which will carry the general sensation from the head and neck region. The sensation of touch, the proprioception, the sensation of pain, temperature, all of this is carried by this column. Now, which nucleus is responsible for carrying the sensation of touch, pain, or temperature from the head and neck region? Remember, if we are talking about the rest of the body apart from head and neck, it has to be the dorsal column, the fasciculus gracilis and the fasciculus cuneatus. But since we are talking about the head and neck region, we are talking about the trigeminal nerve and the trigeminal pathway, right? So this column has nuclei that are associated with trigeminal nerve. Now, what are these nuclei? Remember, in the general somatic efferent column in the midbrain, there is one nucleus which is called as the mesencephalic nucleus. As the name suggests, mesencephalic nucleus is present in midbrain. The function of this is to carry proprioception from the muscles of mastication. Done? This is one. Then the other nuclei we have here is called as the chief sensory nucleus. This nucleus is responsible for carrying the sensations from the head and neck region. What sensation? Touch sensations. How about pain and temperature? Remember, pain and temperature is carried by an elongated nucleus that runs across the pons and the medulla oblongata, and we call this as the spinal nucleus of trigeminal nerve. And spinal nucleus of trigeminal nerve is associated with carrying pain and temperature from the head and neck region. So these are the three important nuclei associated with general somatic efferent column. Done? So remember all these nuclei, mesencephalic, chief sensory, and spinal nucleus, all of them, they belong to trigeminal nerve. And if you observe, trigeminal nerve had one more nucleus. And what is that nucleus? Motor nucleus of trigeminal nerve. So if you are talking about the trigeminal nerve, it has one motor nucleus and three sensory nuclei. Right. So it has special visceral efferent column and it has general somatic afferent column. Done? Right. So this is regarding the important functional columns. The special somatic efferent column, as I've told you, is represented by the vestibulocochlear nerve, which extends between the pons and the medulla oblongata, and it includes the cochlear nucleus as well as the vestibular nucleus. Okay, so this is regarding the functional columns, right? 7 functional columns and their nuclei associated with it. This is what is asked in your exam. Which of the following functional column is associated with the nucleus mentioned? They can point towards the site of attachment of a cranial nerve or location of a cranial nerve nuclei, and they can ask you which functional column it belongs to, or what function will be lost if the marked nucleus is affected. Right. So this is why you should know the position of cranial nerve nuclei along with what functional column they belong to. The other type of question you will get is, what are the nuclei that are present in midbrain? So what are the nuclei present in midbrain? As we saw, it has oculomotor nucleus, the main motor nucleus. It has the trochlear nucleus. Then it has the Edinger-Westphal nucleus and mesencephalic nucleus. This is how you should know. So you should know what are the 7 functional columns, what are the nuclei present in each of the functional column, and where exactly each of these nuclei is located in the brainstem. Done? Remember, when we started the session, I told you the brainstem has attachment of the last 10 cranial nerves. So whatever we have discussed till now contains only those 10 cranial nerves. The last 3 to 12. Fine. So are we clear with this position of cranial nerve nuclei? If we are clear with position of cranial nerve nuclei, what we will do is we'll try to quickly derive the cranial nerve nuclei and the functional column for one important cranial nerve. And we will try with one sensory or one motor nerve and one mixed nerve. So can you tell me, are we clear with this concept? Fine. Do we have any doubts related to the position of the cranial nerves and the functional components? Fine. Now, if you do not have any doubts, in the section of the brainstem, let's try to locate these nuclei. Okay. So first, let's start with all the motor nuclei. Right. Now, motor nuclei will just try to list one by one. So we have one in the midbrain. Okay. So let's imagine there is one in the midbrain, and we will call this as the oculomotor nucleus. Then there is one more here in the midbrain, and let's call this as the trochlear nucleus. So these are motor nucleus belonging to general somatic efferent column. Then in the pons we discussed there is the motor nucleus of trigeminal nerve, right? Motor nucleus of the trigeminal nerve. Then there is motor nucleus of facial nerve, right? Motor nucleus of facial nerve, that is the 7th cranial nerve, right? So these are the two important functional columns present in the special visceral efferent column. We also know that at the same point we also have one more efferent column, and that is the abducens nucleus. Again, remember, all these are efferent columns that we are writing in blue column. Okay. Then, so this is general somatic efferent column. This is general somatic efferent column. So this is general somatic efferent, whereas this and this special visceral efferent columns. Now, if you come to medulla oblongata, what is the efferent column that we have? One efferent column that we have is the nucleus ambiguous. And nucleus ambiguous is common to 9th, 10th and 11th cranial nerve. Then there is one more nucleus here, which is called as the dorsal nucleus of vagus. Dorsal nucleus of vagus, right? And any other nucleus that we have left with? Yes, in the midbrain itself, we have the Edinger-Westphal nucleus, right? So these are the nuclei which are present in the different parts of the brainstem and which are efferent. If we talk about the sensory columns, right, or the afferent columns, the midbrain has one sensory column. And what is that sensory column? It is the mesencephalic nucleus, right? It has the mesencephalic nucleus. Done. Then, if you come to the pons has one more important sensory nucleus, and this is called as the chief sensory nucleus of trigeminal nerve. Chief sensory nucleus of trigeminal nerve. Done. Then, what is the other nucleus that we have here? Remember, the other nucleus, the sensory nucleus we have is, we have one nucleus here which is called as the nucleus tractus solitarius, which is related to the chorda tympani. Then it is related to the glossopharyngeal nerve as well as vagus, which carries taste sensation. Then, apart from this, we have one nucleus that extends from the medulla oblongata to the pons. What is this nucleus? This is the spinal nucleus of trigeminal nerve. Spinal nucleus of trigeminal nerve. Done. So this is one more sensory nucleus, right? Apart from this, we have the cochlear nucleus, which are located in the midbrain and medulla. The other nuclei that are not represented here in this image include, let's say, the superior salivatory nucleus, which is located in the pons, and inferior salivatory nucleus, which is located in the medulla oblongata. And this is what you must know thoroughly, right? You should be able to locate different parts of the brainstem, especially in a cadaveric specimen, and you should also be able to locate the nucleus related to each of the functional column and nucleus present in each of the part of the brainstem. Done. So this is regarding the location or the position of the cranial nerve nuclei. Fine. So if this is clear, what we will do is we'll try to identify the functional components present for one particular cranial nerve, and we will try to identify the nuclei associated with it. Okay. So what we'll do is we'll start with an easy nerve. For, let's say, we'll start with the oculomotor nerve, right? And we'll try to identify what are the functional component present in it. So we will list them first. General somatic efferent, general special visceral efferent, general visceral efferent. Then we have general visceral afferent, special visceral afferent, general somatic afferent and special somatic afferent. Now, can you tell me what type of nerve is oculomotor nerve? Is it sensory nerve? Is it motor nerve or is it mixed nerve? So can you type in the chat box what type of nerve is oculomotor nerve? Is it predominantly sensory or is it predominantly motor or is it mixed? What type of nerve is it? So what type of nerve is oculomotor nerve? Remember the mnemonic, some say marry money, but my brother says big brain matter most. So what kind of nerve is oculomotor nerve? Remember, oculomotor nerve is predominantly motor nerve, right? So it is predominantly motor nerve. So yes, Rahul, you're correct. It's motor. Yes, Gayatri, that is correct. It's a motor nerve. Aniket, remember the mnemonic again? Some say marry, right? M stands for motor here and B stands for both or mixed, right? So oculomotor nerve is mainly a motor nerve. So it should not have what components? It should never have these sensory components. What is the function of oculomotor nerve? It supplies muscles derived from somites, that is extraocular muscles. Then it supplies the smooth muscles of the eye, that is from the Edinger-Westphal nucleus. So you have a component from the oculomotor nerve that is supplying extraocular muscles and one component that is supplying the smooth muscles. There is no component of the oculomotor nerve that actually supplies the muscles derived from branchial arch. So can you tell me which of these three efferent columns, out of these three efferent columns, which functional column is associated with oculomotor nerve? Remember, this supplies muscle derived from somites, this supplies muscles derived from branchial arches, and this supplies the smooth muscles or cardiac muscles. So can you tell me what are the functional components associated with the oculomotor nerve? You said it's a motor nerve, right? So out of these three components, can you help me out with what functional components are present in it? So you can ask yourself this question, does it supply extraocular muscle? Yes. Does it supply any muscle that develops from branchial arch? No. Does it supply a smooth muscle? Yes, the sphincter pupillae. So can you tell me which functional column is associated with the oculomotor nerve out of the ones that we have discussed till now? Remember, it has to be general somatic efferent, general visceral efferent, and there is no special visceral efferent column. The reason for that is this will supply all the recti except for the lateral rectus and the superior oblique. Then this will supply the sphincter pupillae. Done. So this is how you arrive at what cranial nerve contains what functional components. Now, if we have to name the nucleus for it, this is the motor nucleus for oculomotor nerve, which is present in the midbrain, and this is the Edinger-Westphal nucleus. So oculomotor nerve has two functional columns and two nuclei, and both nuclei are located in the midbrain. Right? Now, this is what you need to do for each of the cranial nerves. Right? So you take a cranial nerve, first decide whether it's a motor nerve, a sensory nerve, or a mixed nerve, and then you try to analyze what functional components are completely absent, and out of the functional components which could be present, which are actually present. Fine. You cannot mug this up, but once you understand the function of the cranial nerves, it is very easy to derive the functional components associated with them, and once you know the functional components, very easy to derive at the cranial nerve nuclei associated with it, and from there you can also derive where exactly these are located, at which point or which part of the brainstem these are located. Done. So this is regarding how do we arrive at the functional columns of the cranial nerves and what nuclei are associated with them and where exactly they are present. And remember, if you get questions in cranial nerves, most often nowadays, these are the questions that you're getting, okay? The functional components of cranial nerve, where exactly they are located in the brainstem. So they'll give you an image, and in the image, they will ask you which cranial nerve nuclei is pointed out, or it is representing which functional column. Fine. So this is what I wanted to discuss in the topic of functional components of cranial nerves, right? Now, at this point of time, if you have any doubts starting from the beginning of this session to this part where we discussed about the functional components and how to arrive at, if you have any doubt, please feel free to ask so that before we close the session, I'll try to clarify these doubts for you. Any question related to whatever we have discussed since the beginning of the session? It could be anything. And I had one question on facial colliculus, so let's talk about it before we actually close it. Now, what exactly is facial colliculus? Remember, facial colliculus is a swelling present in the floor of the fourth ventricle. Okay. Now, if you remember, we have drawn this rhomboid fossa, right? The rhomboid fossa, which is divided by a median sulcus, and in the pons region. So this is the medullary part and this is the pontine part. So in the pontine part, we have an elevation called as facial colliculus. Now, how exactly this facial colliculus is produced? So if you take a section here, so let's imagine the medulla looks something like this. I'm sorry, the section of the pons looks something like this, and the facial colliculus is located exactly here. Now, this facial colliculus is produced by, you have the abducent nucleus here, okay? You have the entire facial nerve which winds around it and comes out, okay? So, the facial colliculus is actually produced by the fibers of the facial nerve winding around the abducens nucleus. Okay, there was a question in your INI-CET exam where they asked the injury to facial colliculus will lead to paralysis of which muscle? And they had given 3 options of extraocular muscles and 1 option of a facial muscle. So most of us would make a mistake that the facial colliculus is actually produced by the abducent nucleus. It is not abducent nucleus, remember, it is the winding of the motor nucleus of the facial nerve around the facial colliculus that actually produces, abducent nucleus that produces facial colliculus. So injury to facial colliculus will invariably injure what? Your facial nerve, right? And if facial nerve is injured, the muscles of the face will be paralyzed. Okay, so this is what we mean by facial colliculus. Done. So facial colliculus is produced by the fibers of the facial nerve winding around the abducent nucleus, and it is an elevation which is present in the pons. Okay, I think this was one doubt that was asked in the beginning of the session regarding facial colliculus. I hope I have answered what exactly is facial colliculus.